because we asked Dr. Choucair, who's the commissioner of the Chicago Department of Public Health, to join us here today because we know that schools are not these islands unto themselves, but part of the social fabric of our communities, and that we cannot expect them to address all of these problems. So we asked Dr. Choucair to talk a little bit about his perspective of how the public health community can partner with schools and help them work on some of these issues. So before becoming commissioner, Dr. Choucair had many positions where he worked with at-risk populations and focused on improving community health. He has received many awards for his contributions in the field of community and public health, and we're very pleased that he can join us this morning. Dr. Choucair.
Good morning, everyone. All right, more breakfast, more energy this morning. Okay, thank you for having me this morning. I think racial and ethnic disparities in the U.S. are some of the most well documented. Progress on meeting the Healthy People 2010 goal of eliminating health disparities was examined for both the U.S. The progress on meeting the Healthy People 2010 goal of eliminating health disparities was examined for both the U.S. and Chicago in a recent study that was published in the American Journal of Public Health back in 2010. And 15 indicators were examined, actually. And what we've learned is that between 1990 and 2005, the non-Hispanic Black and non-Hispanic white disparities narrowed significantly for 7 out of these 15 disparities. So that's the good news. Disparities that narrowed included all-cause mortality, cancer mortality, lung cancer mortality specifically, motor vehicle crash mortality, percent of low birth weight babies, percent of no prenatal care in first trimester, and primary and secondary syphilis case rates. So that's the good news. The not so good news is that disparities have actually widened for 5 out of the 15, and those include the heart disease mortality, female breast cancer mortality, diabetes mortality, suicide mortality, and TB case rate. So again, while we've seen some improvement, the overall trend has not shown significant improvement. So we continue in Chicago to have 5 of these disparities that have widened. We've heard Dr. Christopher talking about the social determinants of health, and I'm going to, just in a few slides, highlight some of that data that we have from the National Health Interview Survey between 2001 and 2005. This slide shows that the percent of adults age 25 and older who report poor or fair health. And what we see in this slide is that on average, Black and Hispanic adults have described worse health than white adults. So if you take past the race and think about the poverty level, and what we learn again from the same study is as income goes up, as you can see on the slide, health status improves, or the perception of health status improves. And even adults who are in the middle class, between the 200 and the 400% of the federal poverty level, those folks describe themselves as less healthy than those with higher income. And that's the trend that we call the socioeconomic gradient in health that we're seeing here. And if you want to take that one step further, talking about the health status by race and ethnicity as well as poverty level, what we see that income differences within the three large racial and ethnic groups are examined. Again, in every racial or ethnic group that we examine, health status improves as income increases. So let's talk a little bit about public health and education, which I think is key for today's discussion. We all know, and we've heard it through all the speakers, that health and education are integrally linked. We know very clearly that the public health community and the schools need to work together to address and to improve health outcomes for students. We have tons of public health data that indicate that education levels and health outcome are highly correlated. So when you look at some of this data, we know that college graduates can expect to live at least 5 years longer than individuals who never finished high school. We also know that across racial and ethnic groups, adults with greater educational attainment are less likely to rate their health as less than very good. We also know that even babies who are born to mothers who have not finished high school are nearly twice as likely to die before their first birthdays as babies born to college graduate moms. And finally, we also know that children whose parents have not finished high school are more than 6 times as likely to be in a poor or fair health as children of college graduates. So the link is very, very clear. Just recently, I don't know how many of you are familiar with the county health rankings. Just recently, the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation issued this county health ranking report. And what we learned from this report are that counties with lower rankings have significantly lower high school graduation rates, have much higher rates of unemployment, and have more than twice as many children living in poverty. So what I wanted to take, and Terry talked about many initiatives that the CPS, that Chicago Public School is engaged in around comprehensive health. I'm going to talk just one specific example around the Chicago teen pregnancy prevention. Dr. Bosch mentioned that teen pregnancy is one of these 7 relevant health disparities for strategic priorities in our school. So I thought I'll talk a little bit about the teen pregnancy burden in the United States and then here in Chicago. I think many of us know that teen births in the United States are 9 times higher than in many other developed countries. 9 times higher. And teen pregnancy and childbearing costs to the US taxpayers we're talking about $9 billion every year. And we also know that Hispanic and Black teen girls are 2 to 3 times more likely to give birth than white teen girls. The CDC just issued a new fact sheet that was posted on their website about teen pregnancy, so I encourage you to check that as well. And we also know from a teen pregnancy burden that girls born to teen parents are almost 33% more likely to become teen parents themselves. And only about 50% of teen mothers get their high school diploma by the age 22. What a significant public health issue. So when we were working in, when I was appointed last year, one of the things that we've done as a department was try to identify these public health priorities that we need to work on as a department. And it was very quickly that teen pregnancy came clear that this is one significant public health issue that we need to work on. This is some of the Chicago data. Overall, our rate of births to teenager in Chicago does not exceed the national average. The national average is, we're good compared to the national average. The challenge is we're not good enough. And, our rate of birth rate for teens under 20 is 31.8 per thousand teen girls. But we know that we have some communities where that rate is as high as 54.7 per thousand. And when you look in 2007, for 1,000 females ages 10 to 19, the rate in non-Hispanic Black is 40.5. The rate for Hispanic is 38, and for non-Hispanic White is 6. Clear disparities right there. So during the past 20 years, the rate of teen births have dropped, and it has dropped by 40% since records began being kept 70 years ago. But there are steps that we can take to really keep pushing that decline and helps teen avoid pregnancy. And this is when the Chicago Teens Pregnancy Prevention Initiative was started, and CPS was awarded a $19.7 million 5-year grant to work on this issue through the Office of Adolescent Health. It was a very, very competitive process, and we were very excited to be a strong partner for CPS in that process. There are many, many other partners. I'm sure many of them are here in the room today. The Illinois Caucus for Adolescent Health, Planned Parenthood of Illinois, Chapman Hall, and the Wyman Center. We are starting to focus on access to healthcare issues through that work, and we really wanted to make sure that we're increasing the number of students enrolled in school-based health centers. And I know we've talked about Elevate, and there are many other school health centers in the city of Chicago. We wanted to make sure that we're providing access to healthcare information through schools that don't have school-based health centers, as well as increasing the student compliance with physical examination and immunization. We're really also focusing on engaging students and their families with access to benefits through all kids' health insurance, as well as other resources that they might have. And then we're also happy that we're focusing on expanding the teen hotline to provide 24-hour access to the health hotline to connect youth to health services, as well as being able to collect the data on youth utilization of hotline for ongoing quality assurance. Again, this is one specific example, but I thought I'll share with you how the Department of Public Health is engaged with the public schools as well as other community partners around this specific issue on teen pregnancy. So thank you for having me here. It was a great presentation, and I'll go and join the panel.